All right, so let's continue to this now. The much anticipated judgment in the Life Esidimeni Inquest is expected to be delivered on Wednesday. 141 mental health care users tragically died after they were relocated from the Life Esidimeni in 2015 and 2016 to ill-equipped NGOs. We're now joined via video link by Life Esidimeni Family Committee member and a bereaved family member, Christine Nxumalo. Ma'am, thank you so much for your time this afternoon. I can't imagine what you must be going through now, knowing that you will finally see some form of closure in as far as this matter is concerned. Perhaps, just to give clarity and context, just talk to us about your involvement into this inquest. And of course, you've also lost a loved one.
Afternoon, and thanks for having me. Basically, I am part of the Life Esidimeni Family Committee, and I'm also a bereaved family member. And basically, this was a result of over 1,700 patients being moved from various Life Esidimeni facilities to ill-equipped NGOs. And obviously, as you all know, that 144 patients died. To be honest with you, I think the number has changed quite drastically since, but what we know of is 144 patients died.
So Section 27 has been arguing, and various others, that the former Gauteng Health MEC, Qadani Mahlangu, as well as the former director of the Mental Health Directorate at the time, Dr. Makgabo Manamela, and the owner of Precious Angels NGO should be charged with culpable homicide for their involvement in these tragic deaths, of course, of some of your family members. What do the families hope to see happen come Wednesday?
To be honest with you, Nati, what the families are hoping for is to be vindicated. What families are hoping for is for the judgment to rule in our favor. Because it's been a long way to get to this point. Our loved ones died the most horrendous, the most traumatizing death that you could imagine. And basically what families have been hoping for is just to have people held accountable.
And I mean, when you look at, just some of the tasks at hand for this particular outcome, what the inquest is, looking at, it is to determine, of course, the cause of the deaths, of the 144 mental health care users. And of course, as you say, that number could be more at this point in time, but also to look at the unlicensed and ill-prepared non-governmental organizations, as we also highlighted, in terms of those that should be held accountable. What do you remember, if we have to go back to that time, more than 8 years ago, when you first heard, of course, those news in terms of how some of the patients were treated, as a committee member at the time, of course, and of course, you've also losing a family member?
Unati, all we ever tried to do was to stop this process, because we knew eventually that Life Esidimeni was going to have to close, being a private facility, and that government is supposed to eventually be the one housing mental health care users. So this was a process that was supposed to take 5 years, but it took a mere few months, and hence the deaths. But what we know is us vehemently trying everything we possibly could to get the attention of the then MEC and the director and the HOD. We wrote so many letters, we protested, we did everything we possibly could to try and get their attention, and the attitudes and the arrogance and the rudeness with which we were dealt with during that time did not allow us access to them actually having a decent conversation where we could actually find each other, basically. So it was a very traumatic time, and also knowing that, your loved one is going to be moved, but there's nothing you could do.
And I mean, one of the things in tragedies such as these, where families also, want at least accountability and for their family members not to have died in vain. When you look at the current situation now, in as far as, the social development department and how they continue to lack funding, or their budgets are continuously, being cut, particularly in such instances. I mean, what are your thoughts, particularly as we are now seeing a new government that is being ushered in the form of the government of a national unity? Are you hoping for some changes, as we remember and as we look on to this Life Esidimeni tragedy?
Sorry, your question just sparked some fire that I have about what has happened. You would have thought that with a tragedy like this happening, it would have shaken the Department of Health, or it would have shaken our national government. It would have shaken the presidency. It would have prompted for some action to happen. Believe it or not, we are no better off than we were back then. Things are not happening the way they're supposed to happen. And we're hoping that this judgment will perhaps, and I'm saying perhaps, change the way people think about mental health. The budget is still being cut on an annual basis. So of course there's going to be less and less money going towards mental health. It's almost the easy place to take money from rather than to put money in. But what bothers me more than anything is something that we've raised more than 1 million times, I think, is saying to them that we cannot have NGOs licensing be done by the Department of Social Development, because there are special criteria that are required for an NGO to be housing mental health care users. It is not the same as housing the elderly or disabled. It is slightly different. It's got its own regulations. So nobody and no one has actually come forward and said, we're going to attend to this and look at it differently. That maybe the Department of Health should be the ones doing the licensing, or they do it jointly, but not solely by the Department of Social Development. And that's where the cracks come in, because nothing is being done to address the things that we are saying are lacking and that could actually change the way things are done. And also the fact that there's still no places where people can go and for early detection. So if my child right now is presenting with mental health condition, and I'm not too sure, but I go to the local clinic, they're not going to know how to treat me because they don't have specialists, mental health specialists there, or people who could pick up that there's an issue. So the early treatment is still a problem in our province.
One of the things that, Section 27 also emphasized, during these inquiries and inquests was that over 1,400 of the surviving patients experienced extreme torture and trauma, and their human rights, abuse, their human rights were violated. I mean, some of these individuals are also still, amongst us. I mean, as a committee members, I would imagine you're still active. How are they doing? I mean, how are families doing as you await this particular judgment on Wednesday?
We have actually stayed in touch, I think, from the onset, and this was largely thanks to SADC and Section 27, who actually back then helped us create groups, the WhatsApp groups, and to date those groups are still in place. So when issues come up about treatment in any particular facility, they raise it in the group, and we try to raise the attention of the officials in that facility as quickly as we possibly can. So the groups are still there, but I think they were frustrated with the postponement of the judgment, but I think they're all eagerly waiting to hear what the judge has to say on Wednesday.
Ma'am, thank you so much for your time, and we do certainly hope that that you are satisfied with the outcome of what is going to be what is going to be then delivered on Wednesday. It will, of course, be little comfort, but at least it will be an end to a very long journey for you and many family members. But we do appreciate you taking the time to speak to us. Thank you so much. All right, that was Life Esidimeni Family Committee member and a bereaved family member, Christine Nxumalo, of course, who also lost a loved one during that removal of Life Esidimeni patients who were reallocated to several other ill-equipped NGOs at the time. That was around 2015 and 2016. Of course, the much anticipated judgment into this tragedy will be expected to be handed down on Wednesday this week. Of course, we will be bringing you all of those developments as and when they happen.